Hello everyone, I'm Dr. Qiaoyan Li from the Department of Endocrinology and Metabolism of the First Hospital of China Medical University. I will work with all of you to learn about diabetes. In this chapter, let's learn about the definition and diagnosis of diabetes. Diabetes mellitus, or simply diabetes, is a group of metabolic diseases in which a person has high blood sugar either because the pancreas does not produce enough insulin or because cells do not respond to the insulin that is produced, also called insulin resistance. This high blood sugar produces the classic symptoms of polyuria, frequent urination, polydipsia, increased thirst, polyphagia, increased hunger, and weight loss. Type 2 diabetes is the predominant form of diabetes worldwide, accounting for 90% of cases globally. In China, we estimated the prevalence of diabetes every few years, shows that the prevalence is increasing rapidly in nearly 20 years, and the number of diabetes patients is the largest in the world. The economic burden of diabetes is also enormous. Next, let's take a look at the classification of diabetes. The classification of diabetes include type 1 diabetes, type 2 diabetes, gestational diabetes, and other forms of diabetes. Different types of diabetes have different pathogenesis and characteristics. About type 1 diabetes, the pancreas undergoes an autoimmune attack by the body itself and is rendered incapable of making insulin. Abnormal antibodies have been found in the majority of patients with type 1 diabetes. The patient with type 1 must rely on insulin medication for survival. About type 2 diabetes, it's previously referred to as non-insulin dependent diabetes or adult onset diabetes mellitus. Patients can still produce insulin but do so relatively inadequately for their body's needs, particularly in the face of insulin resistance. In many cases, this actually means the pancreas produces larger than normal quantities of insulin. A major feature of type 2 diabetes is the lack of sensitivity to insulin by the cells of the body. Gestational diabetes occurs when pregnant women without a previous diagnosis of diabetes develop a high blood glucose level. This is related to insulin resistance caused by HCG hormone during pregnancy. A woman who had GDM during pregnancy has 50% risk of developing diabetes later in life. Other forms of diabetes mellitus include congenital diabetes, which is due to genetic defects of insulin secretion, cystic fibrosis-related diabetes, steroid diabetes induced by high doses of glucocorticoids, and several forms of monogenic diabetes. Most patients with type 1 diabetes have antibodies, which belong to type 1A diabetes. There is also a small number of patients who do not have antibodies, which belongs to type 1B diabetes. This figure is a hypothesis of the various stages of type 1A diabetes. The y-axis is the number of beta cells, and the x-axis is time. Before the onset of diabetes, the patient is only genetically predisposition, and the number of beta cells is normal. A variety of factors leads to the appearance of antibodies which can cause beta cell injury, and the number of cells will decrease. If it does not match the body's demand for insulin, blood sugar will gradually increase, first with pre-diabetes and later with clinical diabetes. How does type 2 diabetes happen? There are two factors. One is genetic susceptibility and the other is environmental factors, including overfeeding, lack of activity, obesity, smoking, and so on. All of these factors can lead to insulin resistance and beta cell dysfunction, leading to blood glucose increasing finally. How do the symptoms of diabetes appear? The first is that blood glucose exceeds a certain level over the renal glucose threshold, and urine sugar leaks, which will cause polyuria, and then stimulates the thirst center and polydipsia appeared. With the increasing of urine glucose, the body's energy is lost, and the patient will feel polyphagia and weight loss. How to diagnose diabetes? A fasting plasma glucose more than 7 millimole per liter. Fasting is defined as no caloric intake for at least 8 hours. An oral glucose tolerance test with a plasma glucose over 11.1 2 hours after a 75-gram glucose load. Diabetes can be diagnosed by twice of the above value. It can be diagnosed by twice of fasting plasma glucose over 7. It can be diagnosed by one fasting glucose over 7 and OGTT 2 hours over 11.1. It also can be diagnosed both fasting plasma glucose over 7 and OGTT 2 hours plasma glucose over 11.1. If patients have symptoms of hypoglycemia, then a random plasma glucose over 11.1 millimole per liter are also indicative of diabetes. Classic symptoms of hypoglycemia include polyuria, polydipsia, and unexplained weight loss. Individuals with glucose level higher than normal but not high enough to meet the criteria for diagnosis of diabetes are considered to have pre-diabetes. The diagnosis of which is made as follows. The first, a fasting plasma glucose 6.1 to 7 millimole per liter. This is referred to as impaired fasting glucose. The second, after OGTT, a 2-hour plasma glucose of 7.8 to 11.1 millimole per liter. This is referred to as impaired glucose tolerance. In clinic, the differential diagnosis of diabetes types is mainly to distinguish between type 1 and type 2. Type 1 diabetes usually occurs at the age less than 30 years, particularly childhood and adolescence, but at age. Type 2 diabetes usually occurs over 40 years old, but at an age. Type 1 diabetes has moderate predisposition, but type 2 has strong genetic predisposition. 85% to 90% of type 1 diabetes have one and usually more autoantibodies. Less of type 2 diabetes have autoantibodies. About the endogenous insulin levels, type 1 diabetes are low or absent. Type 2 diabetes usually present early hyperinsulinemia. For insulin resistance, type 1 diabetes only have it with hypoglycemia, but type 2 mostly are present. Type 1 diabetes is more prone to ketoacidosis. How to detect and diagnose gestational diabetes? Screen for gestational diabetes using risk factor analysis and use of an OGTT. Pregnant women who are not known to have diabetes should be screened for gestational diabetes at 24 to 28 weeks gestation with 75-gram oral glucose tolerance test. A diagnosis of GDM is made if any of the following levels of plasma glucose are exceeded: more than 5.1 when fasting, more than 10 at 1 hour, or more than 8.5 at 2 hours. Women with GDM should be screened for diabetes 6 to 12 weeks postpartum and should be followed with subsequent screening for the development of diabetes or prediabetes at least every 3 years. Diabetes also needs to be differentiated from other elevated blood sugar situations. For example, stress hypoglycemia, diabetes secondary to hormonal excess, drugs, pancreatic diseases. Okay, in this chapter, we have learned the definition and the diagnosis of diabetes and understood what diabetes is. Thank you very much.